Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. Today we are going to go into cancers of the head and neck. These are cancers that affect the area of the mouth, the oral cavity, the posterior part of the mouth, which we call the throat, or known medically as the pharynx, and then the lower part of the pharynx, which is the larynx, and also involving the sinuses and the nostrils, and also the areas about the nostril region. So these cancers affect more than 350,000 people worldwide yearly, and they are responsible for more than 170,000 deaths annually. You find that people of Asian origin and people of African origin are affected more, and males are affected more than females. Usually, the risk factors for these cancers include tobacco use, alcohol use, beet nut chewing, infection with the human papilloma virus infection, especially type 16, deficiency of vitamin A, C, and E. We also have those people who have immunosuppression, especially due to HIV, people who are excessively consuming preserved food and those preserved with salt, infection with Epstein-Barr virus, and also poor oral hygiene. There is also some aspect of genetic predisposition, and for people who have undergone any radiation of the head and neck region. You find that these cancers are easy to diagnose, and because the head and neck region is easily accessible, and if lesions are identified early, then treatment and outcomes are better. But due to either ignorance or fear of visiting the health facilities, and also lack of screening modalities, most of the people present late when the cancer is at an advanced stage, and this affects the prevention and treatment outcomes. And when the treatment is initiated is late, and the outcomes are not very good. So what are the signs of the symptoms that these cancers present with? As I have said, these are cancers that affect the oral cavity, and if the presenting symptom is in the oral cavity, they might affect the lips, the corners of the mouth, and this may present with the lesions in the mouth. There could be also sores in the mouth. You could have bleeding and scabs in the mouth. And then usually the lesions, when they are in the mouth, they are usually white colored or they are pink. If the pharynx or the posterior part of the mouth is affected, then you may have pain on swallowing. You may have a change in the voice or hoarseness of the voice. You may also have difficulties in speech. And if the nasopharynx or the part of the nostril is affected, you may have a blockage of one or both nostrils. You may have nose bleeding, and you may also have ringing and difficult with hearing if the part of the ear is affected. So screening of these cancers is fairly straightforward, as most of the lesions are easily accessible and they can easily be identified, especially with inspection of the oral cavity and also palpation of the mouth, the tongue, and also inspection of the posterior part of the mouth with a light. So we find that the diagnosis is usually based on the complaints of the patient. Then you have palpation of the lesions, and then if you find the lesions are there, then doing scans, especially CT scans of the head and neck region, to establish the presence of the lesion, the extent of extension, the size of the lesion, and also you may also need to do scans of the chest for possible staging. The definitive diagnosis is by biopsy. So usually you find that patients who present with these kind of lesions, they are sent to the maxillofacial surgeons or the head and neck surgeons who do a biopsy of the lesion, and this will give a definitive diagnosis of the lesion and the type. You find most of the cancers that affect these regions, 90% of them are squamous cell carcinomas, which is they originate from the epithelium that cover these regions. A few of them might be from the muscle region and the lymph nodes, and also the salivary glands. So there will be sarcomas or there will be adenocarcinomas, but the majority of them are squamous cell carcinomas. So the staging is usually based on the T&M staging method, which the T stands for the tumor size, N stands for the lymph nodes involved, and M stands for the distance metastasis. So at T1, the tumor is less than 2 centimeters. At T2, the tumor is between 2 and 4 centimeters. At T3, the tumor is more than 4 centimeters. And at T4, then the tumor is more than 4 centimeters and it has gone outside the organ of origin of the tumor. And you may have the tumor in the same side of the lesion, and the N2, there is effect on the opposite nodes of the region of the neck, and then in N3 the nodes are large and this extensive involvement of the neck region. For the metastasis, either there is no metastasis or there is widespread metastasis. The treatment depends on the location of the tumor, the stage of the tumor, and the age of the health of the tumor. Usually these type of cancers are usually treated by a multidisciplinary team, which will involve the ENT surgeon for those tumors that are easily resectable. You have also medical oncologist. You may have a radiology oncologist for those that need radiotherapy. And usually the modalities of treatment for the tumor sizes that are less than 2 centimeters, then the best modality of treatment is usually surgical excision of the mass. Of course, there are other things to consider, like preservation of the voice, the swallowing capability of the patient, and so you find all these things, they need to be discussed before the initiation of therapy. For the tumors that are extensive beyond stage T3 and T4, then chemotherapy and radiation are necessary. Then you also have targeted therapy for some of these cancers. So head and neck cancers are common and they cause significant morbidity and mortality, affecting more than 350,000 people worldwide and causing about 170,000 deaths annually. The good thing is these cancers can easily be diagnosed when the lesions are presented early, and also screening, especially with the examination of the oral cavity and the area around the head and neck. As we come to look at the prevention, I would encourage you to subscribe to our channel for more informative content, and also share your comments and also experiences with these kind of lesions. What are the concerns that you have been having? So let's look at the prevention of these head and neck tumors. As we have seen, the commonest risk factors include smoking. So do not smoke, and if you are a smoker, stopping to smoke is paramount. Then avoid excessive intake of alcohol, and as I've said in my previous videos, for men you are restricted to taking not more than 2 drinks of any type, and for ladies is 1 drink. Then protect yourself against exposure to excessive sunlight, and also there is need for the prevention and the treatment of any lesion that presents in the area of the head and neck in a timely manner for more investigations, and also to come up with a diagnosis and definitive treatment when the lesion is still in its early stages, when the outcome of the treatment are more assured and the treatment prognosis is good. Thank you very much for watching.